I'm Dr. Nicole. Today we are going to discuss some common questions around pimples. What is a pimple? A pimple is often a term used to describe a spot on the skin, and the spot can be red or it can have a yellow head on it. The medical terms for them are papules and pustules. Papules and pustules are common presentations of acne. Acne can also present in other ways. Some people have blackheads and whiteheads. The medical terms for them are comedones. Some people have lumps in the skin, and if they are hard, firm, painful, they're called nodules, and if they're soft and fluctuant, they're called cysts. So pimples are just part of the presentations of acne. What causes a pimple? A pimple comes from a pore, and underlying that pore is a hair follicle that's connected to an oil gland. A pimple forms when the pore is clogged and there is excessive oil production in the oil gland. So what influences the oil gland? We all know that genetics and hormonal influence play a big role in controlling the pore and activity of the oil gland. Apart from our hormones and genes, there are 3 other factors that can trigger a pimple. First of all, stress. Stress can make inflammation worse. Secondly, diet. Diet is high in carbs and sugar can cause excessive oil production, which leads to more acne bacteria. And thirdly, skin that is occluded or covered is more prone to clogged pores, and these can also lead to a pimple. What comes out from a pimple? So often when you squeeze or pop a pimple, you see some yellowish sticky stuff, and they are actually a mixture of cell debris. So these are dead skin cells mixed with excessive oil and a little bit of inflammatory cells because of the acne bacteria. How do I know what triggers my pimples? If you're having lots of pimples around the jawline, you might want to look at your hormonal levels. Sometimes, despite normal hormonal levels, you can still have pimples around there because of genetic influence. If you're having lots of pimples around the T-zone or forehead, you might want to look at reducing your stress level and look at your diet to reduce sugars and carbs. If you're having lots of pimples around the cheeks and hairline, you might want to consider avoid touching your face regularly, avoid resting your hands on your face, and also try to avoid wearing any tight headbands or scarves around the hairline.